Good day everyone. I am Victor, the moderator for this webinar. I welcome everyone for today's webinar, How to use G2211 correctly, Billing Documentation and Compliance for 2025. I would now like to introduce our presenter for today, Dawson Ballard. Dawson Ballard Jr. is a highly respected leader in the medical coding field, holding over 20 years of hands-on experience in CPT codes, ICD-10 and HCPCS coding, auditing and education. Dawson holds multiple industry-recognized credentials including RHIA, CCSP, CPC, CPMA, and is an AAPC Fellow. I would now like to hand over the floor to the speaker. Over to you, Dawson.
Thank you, Liam. I greatly appreciate that introduction, and thanks everybody for taking the time out today to join me to talk about the use of G2211. This code has caused a lot of confusion in the pro-fee world, simply because of the fact that while Medicare created this code and implemented it back in 2024, there's been a lot of low utilization around it because there's been some confusion about how to properly use it. So my purpose here today will be to talk about specifically how to use this code correctly. I'm going to start off giving you an introduction, a little history of the code, what it is, how the intended use for it is. We'll go into documentation requirements, and then I'll walk you through some clinical examples that will specifically show you the appropriate versus the inappropriate use of this code. So let's talk about the overview and the purpose of G2211. CMS actually created this code back in 2021. It applies when the provider manages continuous patient care and acts as the main healthcare coordinator. So let's talk about an appropriate use case study here. How would we actually utilize G2211, just to give you a couple of examples? So we have long-term management here, specifically by the PCP. Let's take a look at what we call behavioral health integration. And let's look at one more that would be specific to pediatrics. Now, before we talk about inappropriate use cases, I want to talk for just a moment about some specific documentation requirements that may be needed. Medicare does not specifically say that there has to be any kind of specific documentation requirement to this code. So let's talk about how you would not use G2211. One-time only visits. If another provider manages the patient primarily, G221 billing is inappropriate and can cause compliance issues. So let's talk about some inappropriate use, how you would not use this code. We have a specialist one-time consultation. We have a walk-in clinic visit. We have a preventive visit only. So let's dive into some of the billing requirements. Can I use G2211 in addition to modifier 25? So let's talk about compliance, documentation, and EMR templates. Some of the advantages here. It ensures that providers receive fair compensation for managing complex longitudinal care and interdisciplinary coordination. But there are some challenges. There are some challenges and there are some implementation issues that we need to look at. It requires detailed documentation to support the billing. Improper use of this code can lead to financial concerns, audit, and compliant investigations. So some final thoughts. G2211 recognizes the complexity of longitudinal care, enhancing reimbursement, and supporting value-based care. They can be used only with office outpatient E&M codes. So you can only use them with the 99202 through 205 if they're a new patient, or the 99211 through 99215 codes, specifically if they are an established patient. Don't be afraid to use this code. A lot of confusion around it has contributed to low usage. It's a great way to generate revenue for your practice. Obviously, if it fits, and your billing and your coding staff are also aware of the proper use of this code. It really can be beneficial to establish the continuity of care for your patients, bring in extra revenue to your provider if utilized correctly, And again, I thank all of you for joining me today.
Thank you, Dawson, for this great presentation. That concludes
Absolutely.
the session for today. And thank you everyone for participating. You may all disconnect now. Have a great day ahead.
Thank you, everyone.